elementary school administrator for a very culturally diverse private school in Gwinnett County.
Oh, she gave
I'm
you guys
also
a
a
shout
special
out.
education advocate and a presenter for NAMI. I'm also a suicide survivor. My father, a Vietnam vet, succumbed to suicide when he was 26 years old, and I was only 15 months old. So I've worked over the years and mentored and educated many about the importance of mental health and wellness. Why am I here? I'm here today to share some insight on how I feel and our network feels on making sure that some serious considerations are given to specifics on the HB 1013 bill. I'll be specifically speaking about lines 290 to 293, lines 1013 through to 1061, and lines 1826. We're asking for language access, language support, and culturally, ethnically, and linguistically sensitive services. I want to give you a real-world example of why we think that's important. A few years ago, we hired an immigrant teacher that lost her health insurance when she switched from working with the public school system to working at a small private school. The teacher was a Georgia certified teacher. She was highly qualified and competent. She passed all the background checks that are required in the public school system and passed our background and criminal records check to be hired. When she left the public school system, she lost her health insurance.
Yep.
Georgians have a right to privacy about their health care and their medical diagnosis. She had a mental health diagnosis of schizophrenia. Without her medication and without clinical access, she decided to manage her health on her own. After 3 months, she was in full-blown mental health crisis, which included some behavior that caused her apartment complex to call the police. She was setting fire to bushes and chasing children with knives. She didn't show up for work for 3 days. We went to check on her and spoke to some of her neighbors. So myself, as the lead administrator, and another teacher, after she has no family here in Georgia, we went to the Gwinnett County Courthouse and spoke to a judge and signed an affidavit to show that we thought she would be a hurt and harm to herself or to others. We were told that the sheriff's department would come and pick her up, so we went back to her apartment to make sure that she was there and that she would comply with the sheriff's department when they got there. When the sheriff's department arrived, they brought 3 sheriffs to her home. They grabbed her and dragged her out of her apartment as she resisted, and she began to yell in her native language. Now, as a Somali American, they didn't understand her language. She wasn't resisting going to the hospital. In her language, she was telling them, as a Muslim woman, I should not be touched by a man that's not my husband or my family members. She was also screaming in her native language that I'm in t-shirt and shorts. Can I put clothes on? So her language was disregarded. Her culture was disregarded. And these are some of the things that we want in this bill to be considered, that we make sure that we are taking care of the health and the life and the quality of health and life of all Georgians, and that includes those who are not born and raised here. So our immigrant family members and Georgians also have a right to have a bill that supports their existence here in Georgia.
Have you given us, or sent to either of the authors what you would like to
The
see?
line numbers, yes.
The line numbers and
Yes,
so forth?
and I have that here as well.
Okay. We've used up your time. Is there another one? I'm sorry, your short time. Is there one specific thing? I mean, I think your example certainly brought home something very important for us to look at. Is there?
Well, I'll make sure that it's listed here, and that actual thing is in reference to those 3 sections in the bill itself.
Okay. Thank you.
Thank you so much.
I had another person listed on this.